We're going to get started. Thanks for joining me today. This is Jennifer Kirschenbaum. Many of you I know, we've been speaking on an ongoing basis on how to kind of wind down and stay in this bit of purgatory that most of us are in with our practices and help with our staff, and to continue that conversation and think about how we're going to gear up and maybe use some of this time productively. We're going to have a conversation today about just that, and we're going to go over some of the stimulus that's been offered and is available now, and just what not to do, and preparing for any potential audit that we know is definitely coming your way. And as things come up for the next couple of weeks, the best way to reach me is definitely going to be email, and just something me. That's fine, you can, but I'm just not as diligent at checking that. So please remember to try to reach me on email if you can. So this is what we're going to, well, I guess before we get what we're going to cover today, I'm going to just do a little background on me for those of you who are watching that don't know me, that are not on the newsletter, they're not clients of our firm. But I'm the managing partner of our healthcare department, and we specialize in representing physicians and dentists and other healthcare providers in all areas of their practice, starting from their first contract to their first office, and all the way through with payer issues, employee issues, compliance, HIPAA, STARK, third-party relationships. We've done over the years, the last, I would say 5 to 7 years, a lot with PE-backed. We represent a few PE-backed, very large practices. So we've seen pretty much everything out there, hospital relationships, and counsel to a number of different societies, some of you are members of. And we do a lot of education generally, which is why we've been doing a lot of education during this time when we think everyone really needs it. So today we're going to talk about a financing update, third-party relationships we'll touch on, associate contracts, your homework that I'm giving you, and then we're going to go through questions. So for those of you who have questions, please put them into the question bar. We'll read them out at the end like we always do. And for some who've already emailed me, I've incorporated comments to address questions I've already received, and we've put some of them into the end of the webinar. I'm going to change it up a little bit today because I think some of you must be bored of hearing from me. And I've asked Michael Foster to join us, and Jody Perlman is going to be signing in. They both work with me, and they have different areas of expertise, and they're going to be able to comment on some of the material that we're going to cover. So financing update, conventional loans and markets. I am going to be sending out a link to probably a pre-recorded presentation. There will be more of a conversation that I'm going to have with Regal Healthcare Capital Management that we're gonna do this week, and I think that'll be really insightful on what this private equity firm that specializes in healthcare, specifically doctor platforms. They are involved with a few of them in the region that you guys all know, and they can speak to what they're seeing in middle market lending and with your banks, and what they think is going to be with conventional loans coming up in the next couple of months and years to come, and I think that would be really helpful. What we're going to go over today is a very brief update on the PPP, and we're going to talk about the HHS grant and the Medicare advance payments. And there's a lot in that that needs to be discussed now, because some of you receive money in your bank accounts and you don't know how it got there or what it is, and you don't realize that, or they didn't properly explain there's going to be a lot of strings attached on how you can spend it. So that's what we want to do. We want to put an ounce of prevention in now, so we can prevent from that pound of aggravation later, which is what happened. So on the PPP, some of you are already part of our program, which we do think that you need assistance with the monitoring and preparation for the forgiveness loan, of the forgivable nature of this loan, because if you received your funds, which you may have, or you may be getting it this week, you have to start spending it pretty immediately. You only have an 8-week window to spend it. And how you spend the money is going to be tracked and audited, and it has to be done properly. And that's going to get a little bit more complicated now, just with the HHS stimulus that we'll talk about. Update on funding for those of you who have not received funding yet. A lot of applications are sitting with SBA and have already received pre-approval. That's part of where that commitment of 2/3 of the money you're hearing about on the news, part of that might be your application where the money is waiting to flow. For those of you that have not received approval or an application number for approval and you're not sure where your application sits, follow up with your bank. We already know that they have only funded about 50% of this program, and we know that our elected officials are stuck in partisan shenanigans, holding up funding for the rest of our businesses and doing what they do best, which is failing to legislate. Sorry, that's my just sidebar there. So hopefully they will get out of the way and continue to fund this program, and anyone who does have an application in that is entitled to monies will receive it. Uh-oh, my computer has now shut down. Mike, why don't you tag in for a minute?
Yeah, sure, absolutely. So thanks, Jem, for that introduction. So obviously, as you all know, this is quite a unique time. Some of you may have woke up this morning with extra money in your bank account from the your practice account from the Department of Health and Human Services, with minimal info on where it came from and how it can be used. Let's see, I don't think Jen's back yet, so we can give her a couple minutes, but I'll start to get into my piece more as well. As of April 10th, the U.S. Department of Health and Human Services, HHS, announced that Medicare enrolled providers would begin to receive direct deposit disbursements totaling $30 billion. The $30 billion is part of a larger $100 billion public health and emergency fund created by the CARES Act. CARES stands for the Coronavirus Aid, Relief, and Economic Security Act. You may have seen more of, I'm sure you've seen more of this on the news. This is the large $2.2 trillion plan that our federal government has pushed forward. And this provides financial assistance to physician practices, hospitals, and other providers negatively impacted by coronavirus pandemic. The fund payments are grants, not loans, and HHS will not require repayment so long as certain restrictions are followed and certain terms and conditions, again, which I'll touch on shortly. The funds will go to each physician organization, provider organization's number, so that normally receives Medicare payments, not to each individual's physician. So whoever receives the Medicare payments, whether it's the entity or you as the sole proprietor, that's the person who will receive funds under this the HHS stimulus plan. The funds may be used either for healthcare-related expenses or for lost revenues that are attributable to coronavirus. And according to HHS, the way they calculate how much you are going to get, its providers will be distributed a portion of the initial $30 billion based off their share of total Medicare fee-for-service reimbursements in 2019. So it's a proportion based off your total share of Medicare fee-for-service reimbursement. So that's how they determine how much you're going to get under this program. Each organization receiving grants will need to attest to certain HHS terms and conditions within 30 days of receiving the grant. While it is stated that was initially stated that these grants will be provided with no strings attached, whenever you see that word, there's generally strings attached, to allow healthcare providers receiving these funds to spend in a way that these see fit. Providers should note that there are important terms and conditions that providers will have to submit an attestation to with respect to, as we move further into this below. So some of the key restrictions that are likely to impact providers are as follows. The recipient of any of these funds are obligated to abstain from balance billing any patient for COVID-19 related treatment. So HHS explains that due to the coronavirus public health emergency, patients are more limited in their healthcare choices and may be forced to receive treatment from out-of-network providers. So any providers, therefore, may not seek collection of out-of-pocket payments from a COVID-19 patient that are greater than what the patient would have otherwise been required to pay if they had been provided by an in-network provider. Again, this only applies to those of you who are treating COVID-19 patients. If you are not, this is not applicable. The recipient of any funds must certify that the payment, this is an important one, that the payment will only be used to prevent, prepare for, and respond to COVID-19, which includes healthcare-related expenses and lost revenues attributable to COVID-19. HHS has not yet provided further details regarding this condition. However, in other cases, like the blanket Stark Law waivers, which have recently been issued by HHS, COVID-19 purposes were broadly defined. So again, this goes back to the fact there's limited guidance out there, and part of the thing to be aware of is that moving forward, there will be additional guidance, but for now, we have to go off guidance from other areas of the CARES Act provided by HHS. Another term and condition is the recipient must certify that it is currently providing diagnosis, testing, or care for individuals with possible or actual cases of COVID-19, is not currently terminated from participation in Medicare, is not currently excluded from participation in Medicare, Medicaid, and other federal health care programs, and does not currently have Medicare billing privileges revoked. HHS has not issued guidance again about these restrictions. It is unknown what these restrictions will mean for providers that would not typically be testing for COVID-19 patients, or for providers that limited their current operations due to stay-at-home orders or orders delaying elective procedures. However, the funding of these grants does not appear to have distinguished between such providers. The recipient must certify that it will not use payment to reimburse expenses or losses that have been reimbursed from other sources, or that other sources are obligated to reimburse. Again, further guidance will determine how limitation interacts with other financial support for other healthcare companies as well, including loan forgiveness, tax treatment. So this is where it kind of overlaps somewhat with the PPP and the other programs under the CARES Act. And again, it's to be seen how this will affect loan forgiveness. The guidance is not out there yet, but as soon as we receive it, we will certainly make everyone aware. And additionally, another interaction between other programs is that any recipient who is going to receive more than $150,000 in total funds under the CARES Act, so this includes Families First Coronavirus Response Act as well. So whether it's from the PPP, the stimulus, the grant, any of this, you take all that money combined, and if it's over $150,000, there are additional reporting requirements involved, which will be provided by the government. You will have to make additional reporting in terms of how you're using the money. So just to be aware that if you're receiving over $150,000, you will be subject to additional reporting requirements. Again, the next part is in terms of documentation, which is incredibly important. The recipient must maintain records and cost documentation information to substantiate the reimbursement of costs under this award. Eventually, you will have to submit copies of the records, cost documentation, and fully cooperate in all audits to ensure compliance with the terms and conditions. It's very important to be aware, as I mentioned earlier, that the audits are coming. They will be, this was, again, rushed out, so be aware that audits are on the way, and we want to make sure that everyone's being compliant so that they can receive the maximum amount of free money, for lack of a better term, and their obligations to repay are limited. In addition, the general statutory provision provides that none of the funds may be used to pay the salary of an individual at a rate in excess of executive level 2. This includes a salary of $197,300. So again, many of you may be aware of the requirement under the PPP, which states that you cannot use that money to pay for a salary above $100,000. So it only covers payroll up to each employee up to $100,000. So for here, the HHS stimulus bill, you can't use to pay the salary of an individual in a rate of excess of $197,300 per year. And again, we're still waiting on more guidance from the HHS to determine how this works in conjunction with the PPP and the various other programs. And then just finally, some of the other restrictions, which are not as applicable to most of you, but just worth noting that the HHS prohibits spending on any of these following areas: gun control, lobbying, abortion, embryo research, promotion of legalization of controlled substances, and a few others as well. Providers will have 30 days to sign an attestation through an online portal, confirming receipt of the funds and agreeing to the terms and conditions, most of which we just went through. The online portal is expected to be operational this week. I believe it should be up, if not already, it should be up by sometime either this afternoon or tomorrow. And if the terms and conditions are not accepted by the provider within 30 days, the applicable provider will be required to refund the full payment to HHS. This is important. Make sure you're signing this within 30 days of receiving the funds. Otherwise, you're going to have to pay the entire thing back if it's not agreed to within 30 days through the online portal. So when you do that, make sure you keep a record, whether it's just printing out the page, saving it in your file as well. Again, this will help with keeping good records, which is going to be necessary not only in terms of spending, but various other areas connected to these grants and loans and such. And finally, HHS said it is working to disperse additional funding to providers with lower shares of Medicare reimbursement and Medicaid providers, and for COVID-19 treatment for the uninsured. And there's just a link there as well to some other information. I'll toss it back over to Jen if you're around.
Thanks, Mike. I think I'm back. Can you hear me?
I can hear you. Yep, you're back.
I think my laptop has officially died. Okay, so thanks for that. Then we'll send a newsletter out when the portal opens up for the certification on those funds. So I think we left off on the PPP, and then did you do the Medicare Advanced already, Mike, or no?
I know we just did the stimulus.
Okay.
Yeah.
Okay. So on this, I think we got through most of it, but you're going to sit tight and wait to see if you get the money. Allowable uses, just to go over it quickly, many of you are going to need much more information on this, and the funds are going to have to be earmarked and tracked properly to make sure you're going to qualify for the forgiveness. But you can use 75% of it for payroll costs, which will include group health insurance, paid sick, medical, or family leave, salaries, commissions, and then 25% of it can be allocated towards mortgage, rent, utilities, and interest and other debt obligations. Now, we don't interpret this as allowing you to reimburse yourself for amounts already paid. This is going to have to be earmarked for direct payment. So we're available to help you with this. And for those of you who are already in the program, you're getting a lot of information from our firm on specifics, and we can go through some questions at the end. The Medicare Accelerated Advance Payments, this is a little bit less exciting than what Mike already went through, because this money is basically what it says. It's an accelerated advance on money that Medicare believes you will likely be able to bill if you're a Medicare provider when we get back to things. So for our Part B services, we're entitled to, if we request it, I'm going to tell you how to request it, you can get an advance on 100% of your anticipated Medicare payment based on historicals for a 3-month period. And then Medicare is going to recoup it over within 210 days from receipt. So it's in advance, it's repayable. To qualify, you have to have billed Medicare for claims within 180 days prior to the certification, so when things were normal, not be in bankruptcy, not being under any active medical review or program integrity investigation, and you can't have any outstanding delinquent Medicare overpayments. So if you're already in the RAC program, then that would disqualify you. For you to participate in this, if you want an advance from Medicare, which will have to be paid back, you can call the hotline number, or you can go to the CMS website. Accelerated and Advanced Payments fact sheet is here, and it'll tell you where to get in touch. For our area, New York, New Jersey, Connecticut, NGS is who you call. There's the number. If you need it after this, you can email me. Don't text me, email me, and I'm happy to send it to you. You can email Mike. This is Mike. Mike, you took that picture. What year was that?
That must have been like 3 or 4 years ago.
I think it might be 4 or 5 years ago, Mike. Mike's been doing this longer than he's ready to admit. Okay.
My hair is a little bit longer now.
Yeah. Not too many grays yet, but okay. So takeaways, Mike already did it, but I'll say it was very poorly rolled out, the stimulus. There's a lot of red tape and there's a huge likelihood of audit. For anyone who tried to get the meaningful use payments that's on the line, you can take this and put it on steroids. They're going to absolutely audit to make sure that these funds are being allocated properly. And if you're looking for clarity on what does this mean for our doctors who are paid over 100, can we use the stimulus money to pay them plus use the PPP? I would say we're not ready to answer that yet. We hopefully will be ready to answer that by Friday. And we'll probably do a newsletter on it. Certainly we'll be advising, whoever we're helping with, we'll be sure to get that information out. So, third-party relationships, we're going to, again, do financing later in the week with Regal. And I want to just talk about landlords because we've touched on it very briefly in our prior conversations on whether or not they're negotiating. And they've really kind of been waiting, most landlords, to see who's going to pay them and what they're going to pay. And a lot of my clients have had success with deferral arrangements, calling landlords and saying, look, I want to defer paying my rent or I'll pay a portion now. If you've received your PPP funding, we need to sit down and really carve out how you're going to allocate that money and put what you can. If you're looking for 100% forgivable, we have to see if you stay within that 25% threshold paying all the rent. And that's some math we're going to have to do. Banking relationships, waiving interest and principal payments. We have not seen principal being waived, but we've seen interest being deferred, not forgiven. And it really depends on the specific relationship. Vendors also are being accommodating at this time from what we've seen. However, no one is fully forgiving amounts. And if you're having any problems or if you need to terminate a relationship and there's contract questions, please elevate those before you take any action with a third party. Let us take a look at the agreement and make sure that you're not going to put yourself into default because we don't want to have issues going forward after everything clears up. And on the associate contracts, we're going to go through a lot of questions on this, but for those of us who are on the phone that are associates, I'm not going to gear my comments to you today, really, because most of our attendees, who most of you I know that are listening right now, are the employers. And we have asked for our employees to be good citizens during this time of crisis and for them to understand that we're in severe cash flow. And many of us have had verbal conversations, possibly memorialized, perhaps not, requests that employees, I'm talking about physicians now, doctors and dentists, that they waive or forego their base compensation or at least a component of it during this time. Those circumstances may slightly change once you get the PPP money and you start deploying it. You may pay a portion. What I would recommend and what I wanted this conversation to be before my technology failure was really the start of a discussion on how we're going to get back. And we're going to get to those slides in a couple of minutes. What you should know right now is that whatever relationship you have built with the associate related to COVID should be memorialized in a writing. And plenty of groups are doing that on a one-pager where they're just documenting a percentage reduction in base or draw, or they're documenting that the person will be willing to accept only their production or collection compensation for the remainder of the year or for a period of time, TBD. And whatever it is you want agreed to, it should be in writing, because the reality is that many of us that are not documenting properly are technically in breach of our associate contracts. And I'm not saying that you do employ a person that's going to look to monetize on this scenario, but based on how historic contracts are drafted in healthcare, period, usually force majeure or inability to operate and open has not historically been a reason for an employer to be able to immediately terminate. Obviously, all of us counselors on the line are going to be changing those provisions given the new reality that we're in as of today. We're going to be putting in new termination provisions. But anyway, so we need to make sure that whatever you did is in writing, and I'm happy to take a look at what you've got. And if you don't have anything yet, then I'm encouraging you to do so. And we're going to talk in a minute, I'll keep going, on the homework. So on the homework that we're going to do over the next couple of weeks, or I'd like to have you do, and I'm going to go through some of these in more detail and some of them quickly. I want you to think about your organizational structure. And I'm going to give you an example of what I mean by that. And this is the best time for you to do it. And I want you to think about employee relationships, because I know many of us are not open, or we're partially open, and we have some more time. So compliance, we're going to go over briefly. This is just very quick, a reminder that I've gotten a lot of questions, unfortunately, during this time from our client base that they need to get their estate planning in order. And now is a good time to do it, because you have time to think about what you would want to do. We're going to develop COVID protocols, which I'll touch on, and corporate review. Jody Perlman's going to help me with this. So I thought this was appropriate. We save all these projects for a rainy day, and it is most definitely raining. So let's talk about a corporate structure. We did this morning in my house. It was a project for me, my husband, and my kids. And this is what I think most of your corporate structures look like. And one of the first assignments that I had with one of my favorite client groups I've been working with for a long time now, and this is taking me back over a decade, was the doctor who has unfortunately passed now, and I loved him. He said, I need you to come in and figure out what everyone in my organization does and tell me what they do, and then tell me what's wrong with how we're operating. Why doesn't anyone get along, and why is there so much dissension in my front staff and my billing department and this and that? And this was, pretty big practice. They had about 40 employees at the time in 2 locations. And I did my whole assessment, and I realized, what I realized was most of my clients' problem is that this is what their org chart looks like. It doesn't matter if they have 4 employees or they have 40, or they have, even some of them have 60 or 80. They've been able to create a scenario where the managing partner is the only hierarchy that's in place, and everyone answers to the managing partner, and the managing partner sleeps, eats, and drinks the practice, and there's no order and structure, and that can be fine if it works for you. But you have a little bit of time now to think about whether or not you want everybody going up to you or not, and you can try to work out, if you don't know how to use PowerPoint and this is not easy for you to do on a computer, no problem. But now is a great time to think about, how should your office be operating? Is there a way to break down different areas of your practice and have them possibly run up to another human being that you would trust with decision-making capacity? Perhaps not everything has to flow up to you. And this is a good little homework assignment for our employers to think about and be able to try to restructure at this point. And in addition with that, with bringing back staff, how do I bring back my staff? Well, for many of us, we know the answer to that is going to be, you're going to be bringing them back in stages. You're probably not going to go from 0 to 5 or 6 days a week open. We're waiting to see when there's going to be some lifting on just emergency only care. It looks like that's extended through April. Is it going to go into May? I think many of you on this call are going to have more insight into that than I do. But I'm guessing probably partially into May. And once we start opening, what's that going to look like? How quickly are our patients going to come back? What is our office going to look like? And how do we bring the staff back? Now, many of you heard me, or pretty much all of you on this call probably heard me say I wasn't a fan of the use of the word furlough, because I think that there's going to be an expectation that once you're open, everyone's going to think that they have to come back right away. And so we have to consider, each practice is a bit different. How transparent are you going to be in that discussion? And, my advice is going to vary depending on how the practice is constructed. So it's really a one-on-one conversation. But you're going to bring your staff back in a way that makes sense. You're going to bring your staff back in a way that makes sense with a PPP, knowing that you have to expend 75% of those funds on salary. Okay, if that money comes in. So you might have a lot of people actually on payroll that are not physically doing anything. If you do get the PPP funds, and we need to talk about how that's going to look, once that happens, if you're in that situation. I would like this to be an opportunity for you. So I'm trying to take my lemons here and make it into lemonade, that you have time now to do some of this stuff, to think about the job descriptions. What is the function in your practice that everyone is supposed to fill? Go back to the original offer letters that perhaps you did put together for your staff, not the doctors, but maybe even just the staff level. And then if you want to, for the doctors too, and think it through. Are people pulling the weight that you're expecting them to? Do you have only a few people that are doing everything and then some people that are doing less? And I would use this as an opportunity to really nail down job descriptions for each individual in the organization, or at least categories, depending on how big of the practice it is. You should reassess the contracts that you have or policies and procedures. Your employee handbook may need to be updated. This is a perfect time to do it with your office manager who may be on payroll now with a PPP full time to get it. So I recommend looking at your employment agreements. You're going to have to consider with your doctors, if you have contracts or any of your senior staff you have contracts with, we have to look at the prior terms. This could be an opportunity for you to change how you have a comp structure. Maybe you want to move away from salary. Maybe the person you hired a couple of years ago that was brand spanking new out of training and really needed a day rate or needed a base really can be properly moved to a percentage only now. And this could be an opportunity to recast that contract and possibly make additional changes. Maybe you didn't have a proper intellectual property restriction in there, or you don't like some of the stuff the person is doing on social media and you want to add some restrictions there. This is also an opportunity, which we'll get into the corporate discussion, on looking at some of your corporate review. And Jody will explain what that means to us, fairly succinctly. And if we want to get into a larger conversation with that, maybe we'll do another discussion on it next week, hopefully with no technical difficulties. For compliance, we've already covered this for you guys, and so I'm not going to redo the webinar, but I would point you to it, and I'll send it out in a link on the newsletter. But now is a perfect time for you to be doing a risk assessment. This is free. It's a tool that's online with the government, and it's a good couple of hour questionnaire that you can go through and figure out if you're doing enough to protect against online access. And then I did a webinar on it already that takes you through the tool. And as I said, if you don't want to write this down, this YouTube link down, you can find it on our website. It's on our webinar page, or we'll send it out. The telehealth consent, there's been a lot of material out there that the government is relaxing the requirements for consent and expanding coverage for telehealth. And we don't know when that's going to be drawn back. That's the question here. There's going to be a lot of give in a lot of areas in the government, expansion of powers, expansion of elasticity in review, et cetera, et cetera. But is this our new normal, or is this going to be called back? I don't know. I don't have those answers yet. So we also don't know what the COVID period is going to be. Is it going to be until the whole society is inoculated, or is it going to be until the media cycle changes? So I don't know that either. But I can tell you this, I don't want any of our clients caught with their pants down on audit for consent or for laxity in documentation. So even though we have the flexibility at the moment, I would like everyone to use this time to get their house in order, and let's clean it up. Let's get the right consent. Let's check which program you're using for telehealth, and make sure that even though HIPAA is relaxed at the moment, we don't want you to get too comfortable and go past this period of flexibility with a program that possibly is going to have HIPAA exposure. So I think we should be looking at what you're using for the telehealth, look at the consent, coding and documentation review. That falls very much outside our purview. We would recommend that you work with a coding specialist, or maybe do some of the classes yourself directly if you don't want to bring someone in to do a full audit, or work with your existing providers, and maybe everyone get together for a collective. If you have a few doctors that are working with you on your team, now is a good time to schedule a Zoom and look through some of the notes together and see if possibly you can collaboratively come up with best practices internally. That would be a great exercise for you to do now as well. So just some ideas for you. Estate planning very quickly. Everyone should have in place some sort of will. Healthcare proxy, I think a lot of my doctors have been thinking about this lately. They know what directives they would want in place, they just don't have them. We sent out actually free forms for the healthcare proxy in prior newsletters. If you don't have the link, you can email me or Michael and we'll send it to you. Living will is another document that's fairly simple that can be put in place pretty quickly. So any of these are not much of a problem. The biggest issue is in New York, there has not been clear language that you can execute these things remotely or by electronic. So we are following into that to see if people are still going to have to come in for in-person execution, which we believe right now you probably will. So that's something else to think about. Developing COVID protocols. Yes.
If I could have just, the only thing I did see on that was that they were allowing notaries to notarize the will and the living proxy documents via remote, systems, whether it's Zoom or something like that. I did see that they were allowing that, but so I assume or likely witnesses would be a similar, but I did see that they had relaxed the restrictions to allow for notaries to authorize things via electronic methods.
Yeah, the notary is really good to point out, Mike. Thank you, because for the living will and the healthcare proxy, which you may want if you're working front lines and you're concerned, you're going to want those documents notarized. So that's a good point. And actually, I was surprised to see that locally. I live in the city, and I was out yesterday, and I saw a lot of bank branches are closed now, which they weren't in the first 2 or 3 weeks of the lockdown. So it might be very difficult to find a notary if you are looking for one. So with that being said, we do have notaries, so that's a good point. So Mike, for our clients, if we have to, we can certainly notarize electronically.
Absolutely.
Okay, so I'm going to make it through this one, and then I'm going to turn it over to Jody on the corporate. So for COVID protocols, this is what I found is kind of interesting. So CDC has protocols, OSHA has protocols, but then different specialties have their own protocols. So for dentists, there's some thoughtfulness that has to go into dentist specific. I took a look at the American Plastic Surgery Society. I've taken a look at ophthalmology. I've looked at dermatology, and these are areas that we've already looked at. And Mike and I have been working pretty hard to put together what we believe are a really great starting point of COVID protocols, because you really need paperwork that's going to apply to your staff as you start thinking about opening, and then also the message to the community for the patients. And we want to make sure that we're exculpating your practice from any liability for patients who are going to be coming in after the open date. So I'm not going to go through any of the medicine because everyone on this call has a better understanding of it than I do. But we're going to also have to talk, because some of you may have your own ideas on the parameters you want to set on when your staff really can return to work. I've spoken with many of you who are on this call right now that are friends and that have actually had this thing. I did as well. And I think once you have even a mild to somewhat moderate case, your idea of when it clears might even be different. So everyone is going to approach the way back, I think, a little bit differently. And it's not going to be what I'm very clear on. I don't believe it's going to be one set parameter. It certainly may not be the same parameter for staff that you have for patients. Some of you may want to do your own temperature checks. Some of you may want to not get involved in that and require patients to sign off yourself. So it's a little bit of a conversation, but we're going to start with the basic form. We'll charge a nominal fee for it. And then if you want us to standardize it and to customize it, we will. Okay, so Jody, I'm going to kick it to you. Jody, are you on? Uh-oh. Well, I'm not going to kick it to Jody if she's not on. I'll give her one more minute. It says she's on. Jody, you have to dial in. Your audio pin was not entered. 76 pounds. Okay, I'm going to start and possibly, let me see here. Jody, are you in? Okay, we have Jody.
Can you hear me?
Yes, go ahead. You're on.
Yep.
Yes, go ahead. You're on.
Okay, good. There's a terrible echo on my end, though. But
Move away from your computer.
Okay. Is this better?
Yes.
Yep.
Okay. I'm going to leave the room so I don't hear myself talk. Okay. I'm a corporate and transactional attorney, and I assist Jen in the healthcare department. And she tagged me in about an hour or two ago, and I'm obviously technologically challenged, but I do know operating agreements. So the purpose of this, of Jen dragging me in, is to let you know that while you guys have some extra time on your hands and are doing some spring cleaning, one of the things that you should probably dust off are your shareholders agreements or operating agreements. And the shareholders agreement, it's the same document essentially. The shareholders agreement applies to a corporation, and an operating agreement applies to an LLC. And we assist clients at all varies of levels of operating agreements. We have large companies and practices with multiple classes of shares and private equity investors. And then we also have smaller practices where we need agreements between two owners. And each type of agreement is equally important because the devil is in the details. The operating agreement addresses issues such as management decisions, day-to-day operations, exit strategies, how you want to buy and sell among either existing members or put your company in a position for a sale to an outside party, and how that all affects the existing members or shareholders. So the operating agreement covers basic things like capital accounts, how much each partner has invested, and their rights to distributions, how often, what percentage, should there be minimum distributions to cover taxes, and considerations as to how the money comes in and goes out of the practice, whether or not there are requirements for additional capital, how members can make loans or provide guarantees to lender loans. All of this is addressed in the operating agreement. There's also the operating agreement handles management of the company, and you can decide as to whether if you have members of equal ownership, whether or not all decisions are made by both members, what happens in the event of a stalemate, or if you want to designate certain members who have decision-making authority, and then consideration as to whether or not you want certain decisions requiring a unanimous consent, such as the sale of a company or expanding to additional offices, any expenditures outside the ordinary course of business, if you're incurring new debt. So something to think about is really how the day-to-day management of your company is run and who's in charge of it. And that kind of goes back to what Jen said earlier with her me organizational chart, and kind of who's doing what. So that's something that an operating agreement can cover as well. Most importantly, I think, is the buy-sell provisions and what happens if one party wants to exit, whether by voluntary withdrawal or retirement, if there's a dispute between the partners, if there's some egregious conduct which could result in a termination for cause, if there's death or disability of a partner. All of these things can be thought of ahead of time and governed by the operating agreement. So if an issue arises, you can look to the agreement, and you want to make sure that it's dusted off and current for purposes of buyout and valuation. So you want to really, like a lot of operating agreements could have either a formula to determine a buyout price, which may or may not now be applicable. It could have a stated value of the company that could be outdated because it wasn't updated on an annual basis. There could be a mechanism where it's determined by the accountant for the practice at the time of sale. So all of these considerations can go in to the operating agreement, and whether or not that buyout is based on the earnings of the entire practice or tied to the withdrawing member in more of an eat what you kill model. So if there's a termination for causes that results in a reduction of the purchase price. So all of these are considerations that you want to put in into your buy-sell agreement in terms of what happens if somebody wants to leave. If there's death or disability, does the practice maintain insurance? Also important is what are the payment terms? Do you want to have the buyout payment in lump sum? If that's the case, that could be a significant expense to the practice who's buying out a departing member. More often, you want to have some kind of mechanism to pay out in installments over time. And for those installments, you even may want to take it one step further and provide that if those installments result in an expense in excess of a certain percentage of revenues, you may want the ability to defer that payment. In a situation, where we are now, we have a lot of clients who are revisiting buyout agreements and separation agreements and want to be in a position where they can defer payments because revenues are currently taking a hit for some. After the buyout, you would want to address how do you communicate the change to patients? Should there be a restrictive covenant? Who has access to referral sources and patient records? Who's paying costs for malpractice insurance for the members? So a lot of, I think I also mentioned non-compete and non-solicit. That's something you want to consider. If somebody leaves in the timing in which they leave, do you want them to go down the block and be able to open up a competing practice? Under what circumstances would the practice be dissolved? If you're thinking about selling your business or your company to a hospital, a private equity, an outside investor, another physician, another dentist, what does your books and records look like? Are your contracts current? What is your record keeping like? So organization of your documents is very important at this time. I think that covers most of what you're operating.
That's for financing too, right? I mean, Jody, that's for financing too.
Too, absolutely. Yeah. Now with the PPP, everybody's asking questions about, a lot about your business, and you need to have your books and records organized and know what's in them and what's there and the status of your contract. So it's very important to keep your records organized and know what's there. And we often have a situation where we're assisting a client with the sale or purchase of a practice, and in the due diligence phase, when you're going in and looking at books and records, everything's kind of all over the place and not up to date, and it definitely could affect the purchase price if you don't know the status of a certain agreement or arrangement. So it's definitely important to keep everything up to date. I think that covers kind of most of my quick overview of the operating agreement or shareholders agreement. And we're happy to, Jen and I both are available to discuss any individual needs, and happy to, kind of discuss off the record for 15 minutes or so. If any specific questions anybody has, definitely reach out to us. I know, Jen, is there anything?
No, I guess hang on and we'll see if anyone has any questions. I know everyone's mind is very much fixated on the PPP, which I'm hoping to help them with the forgiveness process for that. But let's see if anyone wants to switch gears and look at some of this cleanup stuff, because I think it's really important. So just hang on for the questions, and we'll. Yep. I'm just going to do a couple of basics that we received beforehand, and then if people want to ask us questions about associate contracts or anything that we've gone over today or anything else that's on their mind, we're happy to field them for a couple of minutes while we're on the line, and hopefully we've figured out our technology all around.
I definitely need a lesson.
Yeah, any techies on the phone. Okay, so how do we navigate rehiring employees who we've put on furlough? And again, I think I already went over this, but I don't believe if we have the PPP money coming in, you might just rehire them full freight. And the other question with the PPP is, when I received this a few times today, is when do we have to start spending that money? You have an 8-week period from when the money appears in your bank account to spend it on approved expenditures to qualify for forgiveness. So not everyone, and I think actually most people, are not going to have 100% forgiveness on this loan, which is a loan. So whatever's not forgiven is going to convert over into a loan that's going to be amortizing at 1% annually, and you're going to have 2 years to repay it. There's going to be no prepay penalty. And so what we're trying to do, most of us, is maximize the expenditures. there's been a lot of questions on when you have to rehire. And I've been pretty clear on my reading of the law, which in its interpretation by the Treasury Department has, I think, been bungled a little bit. The law explicitly says that you have until April 26th to go to pre-COVID hiring levels. The Treasury Department has issued guidance that says that you have until June 30th to rehire everyone, but you cannot go below levels from April 26th. I don't believe that that is where the government is going to land on this. So I think that it's still a little bit open on when you actually have to rehire. However, remember, you have to spend 75% of the money you get in on payroll. The money that you have requested is 2.5 times your monthly payroll. So you have the money to spend on the payroll. So many of us are going to have our hands pushed and are probably going to rehire sooner rather than later so we can qualify for forgiveness. And then we may end up in a period of time, hopefully a short period of time, where we are potentially overstaffed and possibly carrying a payroll through the end of June that hopefully we can utilize. We potentially may not be able to utilize. So I received this question on kind of a good citizen bonus. If we temporarily give some people a raise, if they are going to be helping in the office with only a shoestring staff, what do you think about that? Again, this is more of a holistic conversation on how you're treating your entire staff. But if you have properly terminated everyone and you're under no obligation to bring everyone back at the same time, same rate, this is 100% going to be within your discretion if you want to give bonuses or pay more. The important thing is to treat everyone, if you promise to treat everyone across the board the same, that you stick with it. If you didn't make that promise and everyone was at will or terminated properly, then you can bring back how you want. So I can't give off the cuff advice without knowing what you did in the past, because if you sent everyone a furlough letter, then I'm very concerned about treating disparately and bonusing here, bonusing there, bringing back on different staffing. And this is a conversation that Jody and I have had many times over the last couple of weeks, because there's no legal definition to the word furlough. But in my mind, it means that everyone's going to be treated the same and everyone's going to be brought back at the same time, at the same dime that they were previously. So I think if you start giving disparate treatment out and you've classified as furlough, you might have a bit of a problem. So we can talk about that offline. How do we handle independent contractors who get a percentage of their earnings, so therefore have no earnings other than measly telemedicine earnings during this time? Well, during this time, independent contractors are qualifying for unemployment. So they should be filing in their own right. They also, as self-employed, can file themselves for the PPP. And based on what's going on in the press that I'm seeing, and I have no inside information, I'm absorbing the same news cycle as you guys are, I think that Mnuchin is going to bully Congress into hopefully another $250 billion for this program. And the independent contractors that they file a little bit later, which they had to anyway, their filing date was April 10th, they may get their own money from the PPP. So that's how I would push them. And to go back to Michael's point on the HHS stimulus, individual doctors are not getting that money from CMS. It's only going to be the tax ID for the practice that's going to register it for. So independent contractors that are affiliated, through Medicare, affiliated with the practice, are not going to be seeing that money directly. Okay. Are there any benefits available for doctor employees who are productivity based and whose salaries have been reduced during this time that work is limited? So doctors can file for unemployment like everybody else if the employer is not going to be paying anything, or they're going to be paying a limited rate. And if they are getting a little bit of money here or there for telemedicine or teledentistry, then it's up to the doctor to report those amounts to unemployment on their weekly check-in, which they're going to have. This is the same question, the second one. The practice I work for is open and claiming we are essential, and I do not agree that the services are essential. Do I have to go in? And if you have a contract with your employer and they're telling you have to come in, you're essential, or we want you to do surgery half a day a week on Mondays, and you think the surgeries can be pushed off, listen, this is a gray area. You may end up in a problem with the employer, or vice versa. The employer may have a problem with you, and it's going to be handled hopefully by contract. And we'd have to look at your agreement to see what that's going to look like. But this is not it's depending on what the services are. If it's something that's delineated by a professional society, or specifically through the governor's office, if you're in New York or New Jersey, if it's clear that the services you're doing 100% are non-emergent, then we might have a little bit of a leg to stand on, and you could possibly make a complaint that that's going to put your employment in jeopardy potentially at some point. So you have to be very careful how you handle these conversations. Is my employer in breach of contract for not paying me or terminating properly? Arguably, yes. Is the employee going to be well positioned to make a claim against you at this time or cause a problem over breach of contract? Obviously not. There is good citizenship points that are being earned right now, and this is partially what takes me back to my comments earlier, why I hope that we are documenting any arrangement that we have with our associates in writing, because that's going to save us. So I'm going to go to our questions now, and let's see. So I've answered when you have to use the PPP funds. You have to start using it as soon as you get it. We talked about when you have to bring your people back, so I'm not going to get into that question. Are we allowed to reduce salaries of those earnings less than $100,000 per year? Yes, 100%. 100%. Whatever your employees are going to agree to. So, or if you need to, and you have the ability to fire them, you can fire and rehire, but it's potentially going to be constructive termination if you take someone who makes 145 and you say, look, I'm lowering you to 100. Without their consent, that's potentially a constructive termination. And you just want to avoid that. So if you're going to lower them, as I said before, you could send out a one-pager that basically just has them agree that because of the national crisis, and I've seen most employers leave it very open-ended, that during this time until we tell you otherwise, this is the new salary that you're going to be entitled to. And if the person also has a secondary incentive comp component, then they would be able to maintain that. So absolutely, if they agree, you can lower them. If they don't agree, we can have that conversation. If I lay some people off due to lack of work, it seems that the unemployment amount they get, which is the extra $600, they may not wish to come back. They can make more staying at home until unemployment runs are out. That's a good point, and it was something that I was really concerned about, and I haven't seen New York State adjust for that yet. I figured that New York State would never let them have that happen, and that New York State would lower the maximum that they were giving, which was the 5-something, so that way the extra $600 wouldn't amount to a $55,000 a year salary, which is more than some of the people that we employ make. And they have not made an adjustment. So some people are at home receiving checks for more than they would make going to work. Now, a saving grace, I don't know how much of a saving grace it's going to be, is once you do open and restrictions are lifted, these individuals are basically committing fraud if they have an opportunity to work and they're continuing to certify for unemployment. So I think there's going to have to be some checks and balances, and I also think unemployment is eventually going to adjust for the cap on the compensation. So we'll have to see what that looks like. But to date, I'm not aware of that being the case. And they can receive partial. If you hire people back for 1 or 2 days a week, they can still collect for the other days that they're not receiving what they would have otherwise been making. Here's a complaint about JP Morgan Chase. They've been giving us no information. I applied 10 days ago. Local branches saying they're not handling it. There's nowhere to call. What do I do? We're completely left in the dark. Well, it's a good thing you're with Chase because at least we know that they're processing applications and payments. I would push them for an application number. I would push them to see if they have released your application to SBA, who at the end of the day has to process and fund. And if you can't get that information, then I would put a complaint in and keep elevating it because they're the ones who are going to have to give you that information. At some point, it's going to be out of their hands and with SBA, and that's why they're not getting back to you. Do they have a process of how to refund if you do not want to accept the payment? Medicare, Mike is going to follow up with that and send something out. But yes, they do have a process if you don't want the money because you don't want to administer it. Can you reduce one person to 50% and keep one at 100%? Yes, you can do that, assuming that you have kept elasticity in how you're treating your staff. So, I mean, that's more of a conversation to take offline. I would want to know, what's your staff levels? How have you reduced them? How have you documented it? And how do you propose bring, one person back at 100, another one at 50? If we're treating everyone as individuals, and then I think we can definitely work around that, because you may need some people more than others at this time as you staff up. How is 75% calculated, total staff or per person? The 75% is a lump together of what you are entitled to pay out of the PPP towards, or you're required to pay out towards payroll. So I guess it's going to be total staff, but you can't pay any individualized person more than $100,000 allocated of the PPP. And then based on the HHS stimulus money, we're going to have to look at how that's going to play in and whether you can use PPP funds for up to 100 and then supplement with the HHS money. And I don't have an answer for that yet. We'll have to double check that. Okay. For employees making less than $52,000, they do better in unemployment. How do we get them back to work? Well, I answered it, but I think more directly, how do we get them back to work? I don't know if there's going to be a process set up where your office could actually contact unemployment and say, hey, hello, yoo-hoo, unemployment. I'm trying to, rehire these people. Please stop giving them additional monies. It'll be interesting to see what's set up, because the government is really looking for to get everyone off unemployment. That's why they're giving the PPP money out. So it's going to be interesting how that plays out. I think unemployment is going to have to make adjustments, and we'll see how that's going to go. If I have a physician that works for me, will the PPP count a salary of greater than $10,000? For instance, if a physician's salary is $25,000 per month, will that count as salary? You can only pay a doctor up to $8,333 a month out of your PPP for it to be forgivable. So let's say you have a doctor, and we use easy numbers here because I'm not a math person, that's making, well, I'll use her $25,000 a month. And I said you only can pay $8,300 out. If you can pay the $8,300 out, but you don't want to cut the person from their 25 because you have some money coming in, or you don't want to cut them, you should be paying the $8,000 out of the PPP monies, which has to be very clearly traced. And then you can pay the overage, I would recommend, out of another account, feeding into payroll if you want. And that's where you would fund the overage from. If you do not want to pay the overage out of separate funds, then the only thing you can pay out of the PPP is going to be that cap of the monthly salary of the $8,333. So you're going to be capped. If a doctor employee refuses to work full time, must we pay them the maximum allowable payroll, or maybe prorate and return the money to the bank? So I'm not sure if this question is related to PPP funds, or if this question is just in general for payroll. But if a doctor is refusing to come in and work, but they're under a contract and they have a salary, then technically they're in breach of contract, right? And if they're under a different arrangement with you already, where they've agreed to a cut or they've agreed to a production percentage, then they wouldn't be getting paid regardless. But I think at that point, you're at a standoff, and the doctor's refusing to come in. The doctor is in breach. They're not agreeing to work under their agreement. And you would have to come to a new agreement with the doctor if they're going to come back at some point, on what terms. And I would recommend an amendment to that contract. I wouldn't just do a unilateral modification to the payroll. Okay. When do you need to bring your staff back? We spoke about that. Can you bring only 75% of your staff back, and can you reduce their work week by 25% and you're still not allowed to open? The answer is, depending on how you left it with them, I would say it depends. So I would want to understand what communication you gave at the beginning of this. But if you're free and you have, fired, then I think, just like what we spoke about earlier, I think that you would be able to do that. So, okay. Let's see. The rehire date, again, we went through, I'm not sure. I heard you say that you have to use PPP money immediately. I heard that you have 10 days to start using it since you have to rehire your people. Is that not accurate? You have 8 weeks from the day you get the money to start using it, is my understanding, unless there's been additional guidance. Now, this is a real fluid situation. As we all know, things have been changing pretty much every day. There's new issuance, new guidance issued. So I think that we're just going to have to stay on top of it, and we're going to try to keep doing what we can to give the most current information out, and we'll try to figure out how to use our webinar software a little bit better for the next time. We're happy to answer questions as you have them, so you can feel free to email us. We're here and happy to help and do what we can during this time. So want to thank everyone for joining. Anything I didn't get to, feel free to email me separately, and we'll talk again soon. I want to thank Michael and Jody for doing some prep work for us today.
Thank you.
Okay. Have a great day, everyone.
Okay.
All right.
Bye-bye.